South Africa is in dire need of healthcare workers. Nurses in particular are in high demand. South Africa has a shortfall of 26,000 vacancies to cope with the current demand, yet nurses are struggling to find jobs or are leaving to work abroad. So we find out now whether the country is doing enough to not only train but retain some of these nurses and doctors. We're joined by Dr. Sharon Vasuthevan. She joins us from KwaZulu-Natal. She is an education executive at Life Healthcare. Thank you very much, Doc, for availing yourself this afternoon. Just how desperate is the situation and how reliable is our data collection around this issue?
Good evening and good afternoon and good afternoon to your viewers. I think it is quite a dire situation we find ourselves in, especially post the pandemic, with such a shortage of healthcare professionals, especially for nurses, and I can speak on that. I think there's a number of issues that have contributed to this shortage over the years. One of them being that we've introduced new qualifications for nurses, and we've also discontinued one of the legacy qualifications. And so that contributed to a sudden drop in the number of students that were trained, and so the outputs of our nursing education institutions in the last few years has, decreased. And so that is something we're all experiencing the consequences of that. I think over the last week, we have reached consensus that there is a shortage of specialist nurses in this country. We've seen that confirmed from various authorities like the National Department of Health, the Nursing Council. We heard it come through the HASA conference. So that's a wonderful place for us to be in, where we've all reached consensus that there is a shortage of specialist nurses. And I suppose what's important now is for us to come together as stakeholders and plan a way forward. Because we know our problem and we need to start doing something about it. We cannot wait any longer, and so we need to prioritize the training of specialist nurses, and we need to think about the way forward.
There's a stat that speaks to South Africa's private sector having 17.5 doctors per 10,000 people, and the public sector has just 3 for 10,000 people. I guess it speaks to how desperate the situation is, as you have painted out. But how much of challenge is bureaucratic red tape as well for those nurses who then enter the space?
So I think there's, still a fair amount of interest in nursing as a career. There's a huge number of applications. We've seen that at Life Healthcare, as we offer some of the undergraduate programs, and we get far more applications than we have places to train them. So I think that from a nursing education institution point of view, there's a willingness and there's a commitment to train both undergraduate and postgraduate nurses. It's just how fast, the whole accreditation process will take. As you know, with the new qualifications, nursing has moved into the higher education ban, which means that as providers of nursing education programs, we are subjected to the accreditation both at the Nursing Council, and then it still needs to go to the Council on Higher Education. So that process could take a while, but I firmly believe that if the stakeholders come together, they'd be able to work around this, on condition that providers also play their role and ensure that all of their documentation is in order. And we'd be able to fast track this and really get, more nurses trained who can really start to service our healthcare services, because we need nurses both in, critical care, operating theatre, and the very primary healthcare nurses are also needed. So if we don't have all these nurses trained and qualified and available to our facilities, we need to understand that the communities and the patients will suffer the consequences.
Thank you very much, ma'am, for availing yourself this afternoon. Dr. Sharon Vasuthevan, she is an education executive at Life Healthcare.